Check. 1, 2, 3.
The D.
Brief.
This is the D Brief.
Your guide to Detroit.
Your guide to Detroit's
arts and entertainment scene.
This is the D
Brief.
Hello and welcome to the podcast for Tuesday, March 24th, 2020. I'm your co-host. My name is Seth Ressler.
And I'm Becky Scarcello.
And this is a podcast about the Detroit arts and entertainment scene. When there's a Detroit arts and entertainment scene.
Yes. I mean, it still exists, but on life support.
Yeah, don't use that analogy.
I'm sorry. I know that was poor choice of words.
Yes.
But yeah, I'm feeling pretty sad, feeling pretty helpless right now.
How's your apocalypse going?
You know what? We're fortunate. I'm not gonna complain. We got what we need.
Are you stocked up? You went out to the grocery stores. You got canned goods. What supplies did you actually stock up on?
You know, we didn't.
You didn't. You had enough toilet paper already?
You know, we did, which is funny because I'm a planner, you know, and but not in that sense particularly. Like, I just don't like going shopping, right? I don't.
Yes.
So like when we do, I get the big pack. That's just how I am. That's how we operate. You know, right. I go shopping as least often as possible.
It has been a little freaky because I'm not exactly sure how to prepare. And by the way, today's guest on the show is a guy we've had on before. And if anybody would know, I think he would. We have joining us Dr. Abdul El-Sayed, who we'll have on in a little bit.
Yeah,
this is the guy who, was the executive director of Detroit's health department. He's got a new book called Healing Politics. And he also has a podcast called America Dissected. And so he's, last time we had him on the show, we talked a lot about health.
Yes. Public health.
Public policy. Mm-hmm. And so I'm really glad to ask him because I'm sitting there going, I want to prepare for this thing, but I don't really know how. We bought a freezer. We put some meat in the freezer and bought some canned goods, and I'm going to plant some stuff. In the ground.
I mean, there's definitely part of me is like, have I done enough? Do I have enough? Because
what else do you do?
I don't know. Yeah, and
I'm not gonna lie. I'm not a gun guy, but the thought has gone through my head. Do I need a gun? And I'm like, that's a bad idea.
No,
that's a bad idea.
That is a bad idea.
I don't, but I'm not going to tell you that thought hasn't gone through my head. So
yeah, I mean, I made sure our prescriptions are refilled.
Right, I got contact lenses.
Yes, yeah. So again, I kind of would do that anyway, but it's crazy. It's crazy. I think there's the uncertainty, the limbo is the worst part.
It really is.
Yeah. And now, the shelter in place, which I firmly believe in, should happen, just came down, in the state of Michigan. So hopefully we can flatten this curve a lot more and quicker.
What is your prediction? How long do you think this is going to be?
Oh, I don't know. I'm not in a position to predict that. It's not going to be 2 weeks.
Yeah.
It's not going to be 2 weeks. It's not going to be April 13th.
Well, let's ask somebody who's smarter than us,
exactly.
Shall we?
I'll leave it to him.
All right, very stressful times right now. There is one person that I think might hopefully be able to make us feel better. This is a guy that we have had on the show before. He's absolutely fantastic. Dr. Abdul El-Sayed. He's got a million things going on right now. He was the executive director of the Detroit Health Department. He's got a brand new book out. It's called Healing Politics. He's got an amazing podcast called America Dissected. The new season is all about what's going on right now. And he is now also a contributor to CNN. I can't believe you found the time to join us. Thanks for joining us.
We're honored.
Man.
Thank you.
I really appreciate you having me. I had such a fun conversation with you last time, so figured it'd be a lot of fun to come together. And this is a moment I think of profound stress for a lot of folks. And so if I can at all be useful on answering questions that I know are on the top of people's minds, then it's time well spent.
Well, let's start with the obvious.
Right.
How many people are going to die, and am I going to be one of them? Because I think that's really what everybody's thinking.
Yeah.
I don't know if Wolf Blitzer phrases it that way, but that's what I'm thinking right now.
I think there's a lot of anxiety with this, and it's an unprecedented moment, and most of us have never lived through a pandemic, and certainly not a pandemic of this magnitude. But I will say that there's a lot that we can do to protect ourselves, and I think our policymakers and elected officials are getting wise to the responsibility that we have to do that. Let me just step back and sort of break down how we think about an epidemic, and then where we are right now and why it's so important that all of us keep practicing this physical distancing. You and I are in different places right now for that reason.
Right.
But an epidemic like this, really the response happens in 3 phases. The first is called anticipation and early detection. And we wanted to jump on it immediately when this new pathogen, this coronavirus, emerged in China. That's kind of like, knowing that the toaster could start a fire and being vigilant to make sure that the toaster doesn't start a fire. But if it does, the next step is called containment, right? Which in containment, you're using what's called contact tracing, literally finding every single person who could have been exposed and either isolating them or quarantining them to mitigate the spread. But you're doing it person by person. And if you don't succeed in phase 2, that's like not putting out the fire in the toaster, then at that point it's called mitigation, and you're trying to put out the fire in the house, which is where we are now. And instead of tracing patient by patient, what you're doing is trying to throw up barriers to spreading the disease. And that's why we're all in our houses right now. School is canceled. We have a stay-at-home order in Michigan. And, one that's covering 85 million people across the country. And that's what we're doing. But here's the big risk is that we know that a lot of people are going to get sick. The vast majority of them will be fine. And the vast majority of people, or the majority of people we hope won't get sick. But what we're doing right now is to try and what they say, flatten the curve. And I just want to explain what that means. It means we want to reduce and delay the number of people who are sick at any given time so that our healthcare system has the ability to handle them. Because we don't want to be in the situation that Italy is in right now, where they're literally deciding who lives and who dies because the number of new COVID patients has overwhelmed their healthcare system's capacity to handle it. And so we're doing this work all together, physically distancing to flatten the curve, and then also trying to increase our capacity to get beds and people and protective equipment and ventilators to the front lines in the hospitals to make sure that we can anticipate the curve that's coming and that there is enough resource for the people who do get sick. And so all of us have a responsibility to play to make sure that, A, we don't get sick, but B, we're also not vectors for the disease, passing it on to other people, being that other house that burns down so that the next house burns down and the thing spreads to the neighborhood. So we've all got a responsibility to play here.
We have, as we've watched the news, heard a lot about what's going on a national level or even what's going on at a state level. Most of the people who are listening to this podcast are in the Detroit area, and I know that you know the area really, really well. Can you talk about what flatten the curve means and what our hospital capacity is here locally?
Yeah, well, thankfully we've got a strong system of hospitals, although, they're starting to feel the pressure quite a bit. And one of the hard parts is that to put it in perspective, pandemic spread exponentially. And one of the numbers we look at is called the doubling time. And the doubling time is the amount of time that it takes for the number of cases to double. And right now, it's a really quick doubling time, 2.5 days across the United States, and it's in fact quite low here in Michigan. So a quick doubling time, and you don't want that. You want the doubling time to slow down and ideally get to a point where it's not doubling anymore. And so flattening the curve means socially distancing, staying away from each other so that we're not inadvertently transmitting the disease between each other, while our hospitals, be it the Beaumont system or the Henry Ford system or the St. John system or the St. Joe system or the U of M system, that they can be ready for what's coming. And so I just want you to think about that, right? If cases are doubling every 2.5 days, that means we're going to get a large number of cases that hit our hospitals, and the implications are serious. And I know it's a scary thing, but I do think we have to deal with the reality of this, that a lot of people will get sick and certainly will cause a number of folks to pass. But there's a lot that we can do just by staying home to try and reduce the impact of this thing and make sure that our healthcare workers on on the front lines have the resources that they need to be able to care for our friends and neighbors and loved ones. And so it's going to be a whole of society response. I wish I could tell you that we're all ready to go and it's going to be just fine. This is a real thing and it's very serious. But the best thing that we can do right now is realize what's coming, do our part to mitigate and protect, and spend the time with our loved ones that we can, and remember that that we're all in this boat together.
When you look at a pandemic like this, are there demographic differences or maybe infrastructure differences that make Detroit more or less vulnerable than a city like New York or Seattle or the Bay Area, some of the other places that we're seeing it?
Yeah, I mean, on the one hand, we are far less dense than a lot of those other communities, which is a good thing. Density is a pretty big predictor of the probability of spread in a community. On the other, Detroit's quite poor, and just in our city alone, there are thousands of homes that don't even have water. Right, when the principal recommendation is that you should wash your hands for 20 seconds to protect yourself, that's kind of hard to do if you don't have water. And I know the city has done some things to try and turn people's water back on, but this is the level of poverty that too many people suffer in our community. And when things like this happen, especially in an unequal society, they demonstrate and show the vulnerabilities incumbent in our society, and that's real. And unfortunately, the people who suffer most tend to be the poorest. They tend to be homeless. They tend to be the incarcerated. They tend to be the folks who've had their water shut off or who are liable to have their home foreclosed upon. And a lot of the work that's being done right now is not just to mitigate the disease, but to mitigate the consequences that this disease will have on livelihoods. And so we saw orders out of Lansing to stop evictions and to turn water back on. But forces the question: why do we have these things in the first place? Like why is our society one where people get evicted left and right, or people get their water shut off, or a society that is stamped by the scourge of mass incarceration? And a lot of these vulnerabilities, they come up and are exacerbated by what we're facing right now.
Yeah, I think about, too, just general health. I mean, if the hospitals have to focus on COVID-19 patients, what a time to have a heart attack or be diabetic or have all these other things. Like, I would assume it's going to start to have these other implications for other health problems that aren't going to be addressed during this time.
Yeah, that's absolutely right. And you're right to think of that. That's exactly the problem, is that, hospitals have already had to cancel all all elective surgeries and really, really put all hands on deck for what's coming with COVID-19. And that's true, is that it does put a full stress on our healthcare system, which means that, the ruptured gallbladders and the broken bones and the heart attacks that don't stop just because there's a pandemic are going to stress the system that much more. And so building a system that is competent to be able to care for both the new wave of COVID patients and the persistent stuff, I think that's something that we should all be thinking about after we get through this, right? Because our healthcare system certainly is not geared up for that.
Right.
We're hearing a lot about what the appropriate role of the federal government is in all this, or what the role of the state government is. You worked in city government here in Detroit. What is the role of City Hall in all of this?
City health, yeah.
Well, it's very important, and a lot of the most important and impactful policy interventions happen at the local and state level, especially under this administration. And so, a city health commissioner right now is leading the emergency response at the city level, focused on making sure that residents have the supplies they need, that we are very diligently tracking cases and tracking potential exposures and fortifying our hospital and healthcare system and working with the state and the federal government to try and move information up and bring information back down, and certainly bring down the resources and distribute them as needed.
I wanted to ask you a question about the whole testing. Where did that go wrong, that we don't have enough, or who decides who gets tested and that whole process?
Yeah, a number of places, right? The first is that, in the first batch of tests, the CDC just simply messed up. There was a protocol that was probably too restrictive early on, which meant that a lot of folks who probably needed a test, who should have gotten a test, didn't. And then, the fact that that because of those early mistakes, we stumbled off the starting block. To be sure, right? Our country's response to this has been a real example of what happens when you stop investing in government in any real way, and it's left us far behind where we ought to be. You look at the curve that we talked about earlier. It's steeper right now. We're trying to flatten it. It's steeper right now than it was in Italy at this point in the epidemic, and part of that is just because we didn't have what we needed from the jump, and have been playing from behind throughout, and so it really left us behind. I think we're going to start seeing more testing hit. The question is whether or not it's going to be deployed correctly, right? I think one of the adages in healthcare is that you only run a test that will change your management, and some of the ways that we're using tests right now don't, right? If somebody's been exposed and they have the symptoms, you can pretty well presume that they have the disease. The question is, who should you be testing? And then there's an open question right now in the literature about whether or not the disease is spread by asymptomatic carriers, and if it is, that fundamentally changes the way that we should be testing people.
A lot of the folks that are listening to this podcast are in the arts and entertainment space, and I realize that much of the conversation is much bigger than this right now. But, we are looking at events like the Movement Festival, the Mopop Festival, the Jazz Festival, or Arts Beats and Eats that may happen in the fall. And I think a lot of both artists and entertainers, but also event organizers who put that kind of stuff together are getting hit and are wondering what's going to happen and what they should be thinking about as they look to the future. What is the time frame of this? When is it going to be okay for big groups of people to get together again? What advice would you give to them?
I'll tell you, I understand, and I know that you mentioned that it's bigger than this. I don't know that it is, right? I think these things are what make us human. The ability to come together and enjoy beautiful things together is what makes us human, and that's a real loss. And I do think that in the space where we are lamenting both what has happened and what will happen with serious, loss of life and livelihood. At the same time, I think it's also okay to lament, the inability to do these more basic human things that are the substrate of civilization, right? And so I think that's an important point to remember. And folks shouldn't feel bad for feeling bad. I think that there's an open question about how long this is going to be. My estimate is that it's going to be bad news for at least 2 months. And then, we'll see. And there are estimates that suggest that, after that first wave, then we'll be okay. Other estimates say that it could take as long as 18 months. And, I'm not endorsing that, but I am saying that, I think we do need to tuck in, and it's somewhat reassuring to know that people are already rethinking the way that they engage with each other. And I'll say that, on the micro level, I think a lot of us have had a little bit more time, than our usual busy lifestyles allow us to, reconnect with the things at the most basic level that make us who we are, and who remind us what is important. And I know for myself, certainly that's been true. And at the same time, right, I have a book coming out in just about a week, and I had a 39 stop book tour that would have taken me all over the country that was entirely canned because it wouldn't be safe. And so I lament that, but at the same time, I'm grateful that if this crisis has done anything positive for me, and I know a lot of other people, it's forced us to look inside and ask what matters and what's important. And I am grateful for that.
To that end, this has so many effects, not only on physical health, but mental health. So some of it's positive, like it is good for us to slow down our busy lives and connect with others. But long term, as this goes on, particularly with the elderly, people that are alone, not having the normal physical human connection, what's this going to do to our mental health care system, which is already crippled?
Yeah, it really is. It really is a great question that you asked, because the impacts on mental health are going to be staggering. I think, not only do these moments of mass trauma impact a lot of people and unmask a lot of sort of symptomatology, latent depression or anxiety that's right there under the surface and brings that to the top. But also, for folks who don't suffer, a diagnosable mental illness, it's just not great for mental health to be stuck in your house and not knowing what the future looks like. And I think, there are two things to say. Number one, for folks who need help, make sure you get help. And this moment allows us to connect with folks who can support us through modern telecommunications, if you have access to that, and if you do take advantage of it. But then also, social isolation is really bad for people, and the hard part about social distancing is that it isolates folks. And so, make sure that you're reaching out to people, whether you want to reach out because you're not feeling so great, or because you think they might not be feeling so great. Reach out, connect, get on the phone, get on FaceTime or Google Hangout, and just spend time with folks, because that can be one of the most important things that we can do, and also a way to stave off one of the most devastating consequences of this, social distancing.
You mentioned your new book. I'm going to be honest, I don't know a slick way to make this transition from, hey, worldwide pandemic to let's plug the book. But I do want to talk about it because it is I got a chance to read an advanced copy and it's fantastic.
Same. Yeah, we've been enjoying it.
Yeah, it's called Healing Politics, a doctor's journey into the heart of our political epidemic. I want to ask you about a concept that you talk about in the book, which is social epidemiology. Can you explain what that is?
Yeah, it's there's an eerie relevance of the concepts that I talk about in the book to the moment that we're in. Of course, when I wrote the book, I didn't know that it would be coming out in the middle of a global pandemic. But social epidemiology is a branch of the science of epidemiology, which is the study of the distribution and determinants of disease in populations, that focuses on the social production of health. And what do I mean by that? Focuses on how our social characteristics, our societal characteristics, predict who is healthy and who's not, right? It's this overwhelming recognition across time and place that poor people and marginalized people, people who are victims of racism, people who have to migrate, these people suffer differently when it comes to health, and often suffer more and worse. And so my training was in social epidemiology, understanding how our society shaped our health. And in a lot of ways, it's probably the reason why I ended up running for office, because once you're hit with that profound recognition, at some point you want to do something about it. And the recognition is that, well, if you really want to change people's health, then you have to change the social circumstances in which they live, a la deciding to run for office and trying to change that.
It's funny that you say that, because it does feel like in the wake of this pandemic, all of a sudden you have people talking about public policies that they wouldn't have dreamed of touching before this.
Absolutely.
You know what I mean? Like you've got folks joining the Yang Gang that you really Mitt Romney, things like that. All of a sudden, it seems like a lot of the policy prescriptions out there are changing.
That's right. This pandemic has flipped society over and shown us the underbelly that was always there. And what are the costs of profound inequality? What are the costs of deep social marginalization? And now all of those things are clear. And I think folks are starting to realize, we were never as fortified as we should have been. We were always far more vulnerable. And that's because of this epidemic of insecurity that I talk about in the book. And so you have people who are realizing that we really need to do something about it, which I think is great, but would have been even greater to do before we had to suffer a global pandemic that destroyed lives and livelihoods.
Yeah. There was a quote in the book that stood out to me. You said, quote, "City leadership was often more interested in massaging the media narrative on a problem than actually solving it."
The problem, yeah.
I have a suggested edit for when the second edition of this book comes out. I don't think you need the word city in that sentence. I think
any.
I think any leadership.
Any.
But that's interesting that that's a problem that you've seen before.
Well, I'll tell you, you watch these daily press briefings from the president, and it's a clear manifestation of exactly that point. But I was really frustrated. My first job in public service was as the city health commissioner, and it just became really clear that people wanted to change the narrative rather than change the facts on the ground. And I wanted to change the facts on the ground, and clearly those two things were not consistent with each other. And it was just deeply frustrating. It's a big reason why, again, I thought that the work I was going to be doing was taking this work in the health department, rebuilding a department, and being able to change facts on the ground, until I realized that actually, if we're going to be able to do this, it's going to be because we have to change what actually happens in people's lives. And at some point, the irony of it is that you do have to change the narrative, but you have to do it in fact, right? I've come to the appreciation that I think politicians are good at one of two things. They're either profoundly good at telling lies or profoundly good at telling the truth. Mm-hmm. And we have to elect the ones who are profoundly good at telling the truth.
That's a great goal.
Yeah.
Yeah.
All right. With that in mind, here's a question for you. And it's a hard one. Don't screw it up. What do you say to Americans who are scared?
I understand. I am too. But the only way through the fear is to fix what it is that's causing it. And I think there's a classic response to fear, which is fight or flight. And I think, laying at home under the covers, although for the end of this pandemic, yes, stay at home under the covers. But figuratively speaking,
right.
Staying at home under the covers and pretending like the problem's not really there isn't going to solve the problem. And in fact, all it means is that we're going to leave it to our kids and our grandkids. And so I think we have a moment right now as we emerge from this, and we will emerge from this, that we can decide either to continue to ignore the problems that created it or to roll up our sleeves and solve them. And I hope that we choose to do the latter.
Agreed. I think there's tremendous resources and opportunity for that to happen, and I hope it does.
All right, Doc, I do want to close out on a happy note. Let's talk about something, because there's a place that you mentioned in the book several times, and I want you to just tell us a little bit about what it means to you. You tell a number of stories about Eastern Market.
Yeah.
Tell us about what that place means to you.
Yeah, no, it's such a touch point for me and my family. My dad immigrated from Egypt, and his father sold vegetables in a fish market. And so when he came here, he was a student at Wayne State and didn't quite trust the stuff that came in plastic bags from Kroger. So he'd go to the Eastern Market when he was a student. He'd walk from the DeRoy apartments, no longer there, to the Eastern Market every Saturday, and he'd come home and he'd cook, his mother's dishes that he had learned to cook with her. And then growing up, he'd always take us there. And it was just this amazing space to both see my dad fully alive and also to connect to folks who are all coming to, pick up the ingredients that they'll take home to make into the things that they remember, the recipes handed down across generations. And so it's just a special place. And, we launched our campaign there, and another reason for great memories. And whenever I can, our family will go on Saturdays and just take in the sights and the sounds. And, I hope when this is all over, it's going to be another thing that I look forward to sharing with my daughter.
Absolutely. Yeah.
All right. Dr. Abdul El-Sayed, thank you so much for joining us. We love having you on the show. I got to tell you, hearing you talk about it always makes me feel, I don't know, just like there's somebody who knows what's going on.
Somebody who cares and
understands.
Really working on it. Yeah.
And if people can't have a conversation with you themselves, there's a number of different places that they can hear what you're talking about. You've got the new book. It's called Healing Politics. Where can people get that, and when is that out?
Yeah, it's out next Tuesday, and it's is available at healingpoliticsbook.com. And I hope folks that will pre-order. And if you're into audiobooks, I narrated the whole thing. So if my voice hasn't annoyed you too much, you get 10 more hours of me on that book.
Well, and we can also get your voice on the podcast, America Dissected. Season 2 is, in the process now, and this is going to focus entirely on COVID-19. Is that right?
That's right. We're going to pick apart different aspects of it and really think a lot about how this was created, what we can do about it in the back end, and then keeping folks abreast of some of, picking apart some of the ideas that we hear in the media all the time. What does it mean to flatten the curve? How do we know what we think we know? Are hydroxyquinoline and azithromycin the right treatment, even if Dr. Fauci says they're not? And so we're really trying to go deep on some of these issues and have a conversation that matters.
It's been good. And so you put out new episodes every Tuesday, Friday, and is that just going to be until you don't have to anymore?
That's right. We're going to be planning to put out these episodes until there's nothing more to talk about, and I look forward to when that's the case.
Well, I hope it's a short season.
I know.
Yeah, me too.
Yeah.
All right. Thank you so much. I really appreciate you taking the time, because I know that there's a lot going on and your expertise is highly sought after at the moment. So we really appreciate it.
We appreciate you, and thank you again for having me on. And I really appreciate this space, and it's always good to chat with you guys.
I've always liked him.
Oh yeah,
He's
great.
He's a smart dude.
Smart dude. I like how he gets to the point. It's very informative.
And you remember last time we had him on the podcast, he was sort of in that transition period. He was moving to Ann Arbor, and he was like, okay, obviously
not quite sure
what I'm going to do next. Now he's got a million things going on. He's got a podcast. He's got a book.
Well, you knew that would happen.
He's on television with CNN all the time. Of course we knew that was going to happen.
Yeah, no, I have great respect for him.
Yeah.
And he's that great blend of just knowledge and science, but so human, so kind, and looking out for the greater good.
So, all right. Look, there's not a lot going on in the Detroit arts and entertainment scene. Normally, this is the time where we do our event picks for the week,
recommendations,
or stuff that's going on. We recommend that you stay at home.
Well, yes, and definitely support artists and entertainers any way you can. I've been having really some fun scrolling through, seeing what everybody's doing on their live Instagram, on their Facebook Live, on their YouTube. Check that out, engage. It's good for your mental health, and it does support the artists and helps them still be displaying their creativity. There's small businesses you can still support in different ways. So still do that for sure.
Speaking of supporting artists, we have been closing our podcast episodes with a song from local musicians. What have you got for us today? Yeah,
so this week I tried to pick, and it was amazing. It's just sort of fortuitous, the things that came in that are so relevant lyrically. So this song is called One Person Party by Holmes. And this guy is a grandson of Purvis Jackson of the Spinners. His godmother is Martha Reeves. He's got this whole musical family, and he had a stint in the Army as a combat medic, but he's been doing music a lot more lately here in Detroit. And as he gets older, he's found, he wants to stay home more often.
Well, that's good. That's convenient.
But so it's sort of prophetic that he wrote this song a while back, that it turns out, hey, I used to feel like I shouldn't maybe stay home as much, but it's helping me be creative. It's good for me, and it's good for making music. So he released this song a couple months ago called One Person Party. So check it out. All right, we will take a listen. Normally we end these episodes by saying Detroit's moving, but it's really not. So I guess we say, Detroit, don't move. Right. Stay put. Stay put. Yeah.
Stay in the house. I don't have FOMO, not going out, so save your promos. It's a one-person party, dancing all by myself. It's a one-person party, at home in my underwear. Grooving home alone, and that's the answer. When I go out, there's always problems, and it takes too much time to try and solve them. It's a one-person party, dancing all by myself. It's a one-person party, at home in my underwear. That's you make a bop, that's how you stay on top. You go out while you working and your shit flop. And when you're wrong, you know it's hard to cop, so you just stay home until your album drops.
I stay home alone and get my grind on. That's how I stay dope. They ask, I say no. I'm in the zone, don't call my phone, cause I won't pick up even if I'm home. I'm trying to do a new thing, see if I can. I wanna be the shit, I wanna be the man. Just poke the bear, don't be scared. And if he don't jump back, then you know he lacking. You could take his spot and you could get on top. And that's the way it's gotta be if you can understand. You gotta know what you're doing, gotta have a plan. And that's the way that you become the man.
One person party, dancing all by myself. It's a one person party, at home in my underwear. I can just chill. I can just chill. One person party. One person party. Just one person party. Just chill at home with a one person party. A party of one. I'm gonna have some fun. One person party.
The D Brief.
Your guide to Detroit's arts and entertainment scene.